All right, today we're going to be diving into the hottest topic in health and fitness right now, which is GLP-1 drugs. So, you guys have probably heard names like Ozempic, Wegovy, Mounjaro, Zepbound, and one of the newer ones, Retatrutide. They're all over social media right now, and there's a pretty good chance that you know someone that is probably taking it right now. So, today what we're going to do is we're going to unpack what these drugs actually do, how they work, who they might help, and also some of the potential downsides to be aware of. Now,
Yeah.
quick disclaimer before we get into it. We're not doctors or medical professionals. This is purely for educational and entertainment purposes. So if you are considering taking any of these medications, make sure that you consult with your healthcare provider first. Let's start at the top. Can one of you guys explain what a GLP-1 is exactly and what it does in the body?
Yeah, for sure. So my dad actually is currently taking these and has seen some amazing results. But GLP-1, I think it's important to note that this is actually naturally produced in the human body, whether you are obese or not. Okay, this is a peptide that is formed in the gut, and it stands for glucagon-like peptide. One just kind of being the one agonist here in this case. So when we're talking about GLP-1, this is a subcategory of hormone called an incretin, which typically, when we think about that from a biological standpoint, helps us process food. So GLP is made in the human body. And now a GLP-1 agonist, thinking Ozempic is our most popular kind of keyword, hit word that you're familiar with. This is mimicking this natural peptide in the body at its receptors. And GLP specifically has receptors in three areas of the body. The first one, obviously, being the brain. So, you've heard about Ozempic helping you to kind of navigate that food noise, suppressing appetite, feeling more full after eating. The next one is going to be the pancreas, where kind of the magic happens at the alpha and beta cells, talking about insulin and glucagon in our chat today. And last but not least, in the stomach and the intestine, that when GLP-1 is being bound as the agonist for the drug, we're really going to notice that we are slowing gastric emptying. So you're not moving that food through your body as quickly, digesting a lot more slowly, therefore feeling fuller for longer. And that has like a synergistic effect between the brain, the pancreas, and the gut all together. Okay, so GLP-1, that's kind of where we're going to start off with what it is. And I think it's important to note that there are multiple pathways that can be involved to enhance GLP-1's effectiveness. So when you hear the terms nowadays, GLP, GLP-3, talking about other different forms of that medication, that means that other pathways have now been involved besides just the GLP-1, the glucagon-like peptide of the human body. Okay, so we're talking about making sure that we are seeing the insulin levels stay more stable. We're not seeing those huge spikes in blood sugar, which is bad not only for body fat percentage, but also can lead to other health problems such as heart problems, struggles with your vascular system. And more stable glucose levels in the human body do help to keep the appetite down over time. Now, people will kind of come in and want to be using GLP-1 drugs for weight loss, but there is a lot of research emerging here that this is also great for diabetes management because obviously people who are insulin resistant or do not produce insulin readily, like at all, in order to keep these things regular, we are noticing a lot of really great feedback here. With that being said, there are some things that people are abusing when it comes to GLP-1s. So I think it's important that we have this conversation from a place of maybe 2 years ago. If you asked me my thoughts on GLP-1s, I kind of would have turned my nose up, kind of had more negative things to say. But now that I'm learning a lot more about it from an open mind, I'm seeing a lot more positives coming through from both the weight loss and the health, long-term health effects.
Yeah. And like you mentioned, type 2 diabetics also utilize GLP-1s, and they were originally developed for type 2 diabetics to help
Weird.
them regulate their blood sugar levels. But then doctors were noticing that their patients were actually like losing a lot of weight as I guess you could say a side effect. Like their appetite was going down, so they weren't eating a lot. Cravings went away, and I noticed you mentioned food noise earlier. Maybe we'll dive more into like what food noise actually is, because this is a newer term that I pretty much only heard of maybe the last 12 months.
Same.
Prior to that, I had no idea what food noise was, and I think become popularized with these GLP-1 drugs.
I agree.
And as the food cravings go down, goes down, so does the food intake. So we kind of started seeing the shift from treating type 2 diabetes to more focused on weight loss. And I think that's where we started seeing like a big surge of these drugs in the market. And another term for the GLP-1 is semaglutide.
Yes.
Other versions have been making headway, like tirzepatide and retatrutide. Are you guys familiar with these ones and what makes them different from a semaglutide?
For sure. Like I personally have seen someone be using this Retatrutide and it's basically acting as like a triple action shot. So first, obviously we touched on the GLP-1, glucagon like peptide 1 that helps you feel full, slows your digestion, lowers your blood sugar via those alpha cells in the pancreas. When glucagon is lowered, blood sugar levels are rising. So that's the GLP-1 aspect. Now, when we talk about Retatrutide, it's also a second agonist, which is GIP. And please excuse me, listeners at home, glucose dependent insulinotropic peptide improves how your body uses insulin and helps regulate fat storage, right? So when we think about insulin in the human body, it's a hormone that's produced at the pancreas that allows glucose to enter the cells and regulate blood sugar if it becomes too high. Fat can be stored as glucose, and inversely, glucose can then be stored as fat, right? So kind of that back and forth process is happening there. And then last but not least, the third GLP-3 Reta, glucagon, is actually part of this. The receptor raises the body's metabolism, increases energy use to help you burn more fat. So this is kind of a triple shot that is going to be reducing hunger, making you feel full for faster, and helps your body burn more calories and fat at rest. Because obesity, sadly, like fat tissue is alive. Like it doesn't just sit there dead in the water, right? This is very inflamed adipose tissue. So in reducing that inflammation of the adipose tissue, it's going to be better at releasing its glucose, therefore making you more metabolically active. So that's the Retatrutide. I don't know if any of you guys have heard about it or
Hmm.
had any thoughts on it.
Yeah, it's probably the most, like in my opinion, like right now, trending is the
Mhm.
most popular out of the three. Like Retatrutide, tirzepatide, semaglutide. I've been seeing more and more stuff about retatrutide lately. But the thing with retatrutide is it's not FDA approved yet. It's still going through clinical trials. However, semaglutide and tirzepatide have been FDA approved, and that's why, we're seeing like the big brand names like Ozempic and Mounjaro and Zepbound just, charging a lot of money for these
Mhm.
medications.
Yeah, the Trizep is the injectable medication. Most of these should be done as injectables, dose dependent based on this person and how much weight they need to lose. The oral ones are popular, but if you think about literally a peptide, this is going to be broken down. It's a chain of amino acids going to be very quickly broken down by stomach acid. So it is most like best to use as an injectable, but it's only working on those two hormones, the GLP-1 and then the GIP. So the Trizep, the Zepbound, Mounjaro, whatever we kind of want to call that, GLP-2 agonist. It's a dual action version versus that triple action. So helping you again eat less, control your cravings, and lose significant body fat.
So let's talk about the financial side now. How much are
Mm.
people actually paying for these drugs?
Oof.
So
If
a
it's per
lot of
month or if
them,
it's per use or however we're gonna break this down.
Yeah.
yeah, definitely dependent on the use of the individual. Just like Anna said, depends on like how much weight they're needing to lose, like their dosing, all of that. I find, or I've found that as soon as like it's FDA approved, like a lot of these drugs, that as soon as kind of big pharma gets their name on
Mhm.
that, they jack up the price of everything, just like everything else. So
Yeah.
that is one of the biggest barriers with these GLP-1s is like the cost and the accessibility of things. So I pulled up a fact, and I guess these medications, I personally have not taken them myself, but I know people that have in Canada, and I know it can depend based off of like Canada, North America, sorry, the States,
Yeah.
but it
Mhm.
can be anywhere from 900 to $1,300 a month. And yeah, it's total, yeah, it's pretty
Mhm.
crazy. And especially if you don't have insurance coverage, one of my best friend's mom is currently on it, and that was one of her biggest barrier was her insurance coverage was just not going to be able to cover it. And I think it was going to be in upwards of like $500 a month. So that was her barrier to being able to start that. Even if you do have coverage, a lot of plans don't include it or they require like prior authorization. There's like a lot of loopholes that you have to go through. And sometimes they only apply to certain people or like certain conditions or if you have certain income levels. That is a big barrier for a lot of these drugs. And then not only cost, but also accessibility as well. So, with the increase in these medications, especially with social media, I also feel like as soon as I go on TikTok after this, I'm just going to see Reddit all over the place. There's a
Mhm.
lot of private companies in the States and a lot of people and influencers that are talking about these drugs, especially Reddit. So, that has definitely increased the shortage. And there are a lot of people out there who need these semaglutides like Ozempic and tirzepatide and whatnot to
Mhm.
manage blood sugar levels and like their actual conditions and not just fat loss. So it's kind of created a situation where people like genuinely aren't able to have consistent access to these medications. So it is important, like if you are considering going on any of these medications, to really consider the cost of these things, how long you are willing to be able to pay for these medications, the accessibility, your insurance coverage, and all of that. It's definitely not a long-term fix, and you also need to consider coming off of it as well.
Mhm.
And then just hopping into just like, does it actually work? Like, is it
Mhm.
worth, investing in these medications and trying to just have access to them? So these GLP-1s, they, like Anna said, like in the past, I probably would have had a more closed mind to these things, but going into or like looking over these medications with a more open mind, I think that they can be great in a lot of ways. They definitely work, like we've all talked about. They help regulate your blood sugar levels, they help slow gastric emptying, and they really help with just decreasing that fullness. And that helps a lot with people who are dealing with that food noise. And that's become more of a popular topic in the last few years. And it's definitely, I'm sure all of us coaches can relate with different clients. Like I'm sure we've had people that have talked about struggling with food noise and just like your relationship with food. So it definitely works, and it helps with a lot of fat loss as well. I have a fact here that the average weight loss is around 15 to 20% of total body weight for over about a year for many users. So those results are pretty significant. And then just wanted to hop into like the coaching perspective of things, like even though these medications work, they need to be taken along with lifestyle changes. So I
Mhm.
think that's probably where some of our hesitancies as coaches have come from when these medications first came out, is just seeing people hop on these medications without creating any lifestyle changes. And that can be a problem, especially as people start to come off of these, because if you don't have sustainable habits in place, especially once you come off of these medications, because for a lot of people, especially if you are leaning into them for to deal with like obesity, then it's not going to be a long-term thing, right? So you need to make sure that you are developing sustainable habits along the way in terms of like strength training and building well-balanced meals to be able to regulate your blood sugar without necessarily having to always rely on these medications. Same with like getting more movement throughout the day, staying hydrated, like all of these things are really important so that when you do finish these medications, if you are someone who is coming off of it or using it for obesity, that you don't end up gaining all of the weight back because that's a problem for a lot of people. And then in terms of hunger as well, so I just wanted to kind of talk about what hunger actually is
Mhm.
and food noise. So in terms of hunger, it's not just like a biological thing, it's also a psychological thing and an emotional thing as well. So in terms of like the science side of things, like the physiological side of things, so hunger is regulated by your two different hormones. So we have ghrelin, and that basically just signals to your brain that it's time to eat. And then we also have leptin. So that is your satiety hormone, which signals to your brain that you are full. So these GLP medications, they directly influence these pathways. So basically what they do is they help suppress that hunger hormone and they enhance the brain's satiety hormone. So you just don't think about food as much when you're on these medications. So it kind of helps minimize, I guess, like the food noise for a lot of people. And then that kind of leads me into talking about like the psychological and the emotional side of hunger, because as soon as you start to eliminate the biological hunger and you kind of bring down that food noise, you're not feeling as hungry, it allows people to kind of think about other reasons for why they eat. So sometimes we're not always eating because we're actually hungry. A lot of the times it can be due to like emotion, it can be due to going through stress. That's going to increase your blood sugar levels, or leaning into food for hunger is a big one for a lot of people. I know that as coaches, that's something that we help a lot of our clients through. And so when you kind of like eliminate the biological side of hunger, you really start to think about like, okay, am I eating because I'm stressed? Am I eating because I'm bored? And I find that it does kind of help people just create more like self-awareness around their eating habits. And I find that if someone is dealing with a lot of food noise when they're not on medications like this, it can be really hard to decipher between the two. So I think that that could be like a positive of these medications, is helping people just create more self-awareness around like their eating habits and their coping mechanisms. So I think it's a good opportunity to help people separate the difference between the two.
Now looking at all the research and hearing even like some of the top experts in the health and fitness field talk about like how effective GLP-1 drugs actually are, one question I had is like, why isn't everybody just take it then? And I think it ultimately comes down to personal choice, the cost of the drug, like we were saying, the ones that are FDA approved right now are anywhere from $900 to $1,300 per month. And if it's worth it to you at the end of the day, if we're looking at someone like that is a good candidate to take a GLP-1, I think it's number one going to be for anybody that is a type 2 diabetic or has insulin resistance. Second would be if somebody is obese or very overweight. So we're talking like from a male, it would be like 25% body fat and up. And from a female, it would be like 40% body fat and up. And then just people that have generally tried following a structured nutrition training program and just cannot seem to make any headway with progress. I think those would be a good candidate for a GLP-1. And I think it's pretty incredible that we do have access to these drugs now, because there have been times in just like my own coaching experience where you do everything you possibly can to help a client, but just with other aspects, if it's emotional standpoint or a mental standpoint, it's just very difficult for them to be able to adhere to that level of a calorie deficit. And if these medications can actually help them break through that barrier, then I'm all for it. If you are just trying to lose like 10 to 20 pounds, I think, we've all helped clients for, anywhere from 3 to 10 years here be able to accomplish these fitness goals without having to take a GLP-1. And that's just simply by dialing your habits, right? So, eating in a calorie deficit, training consistently, drinking your water, getting enough sleep at night. Because, if you take these drugs without putting in the effort into, establish a healthy routine, by making sure you're eating enough protein, exercising regularly, when you stop taking these drugs, you are going to lose muscle and you are going to regain all the weight that you did lose.
One thing I thought was super interesting, people had found that in those first couple of weeks of taking these drugs to help press those cravings,
Yeah.
where the GLP-1 receptors are in the brain, are also found near areas of dopamine and happiness and reward. So when they blocked those feelings, they really also did notice that people were starting to just not really feel anything at all, not just around food. So it is just like a little bit of a like warning sign that obviously if you are someone who's getting ready to take these drugs, you're considering these drugs, like you obviously are in a bit of a place where those receptors are a little bit imbalanced anyways. So just to be very aware that yes, if you start taking this drug, like it might really help with the food noise and those feelings of reward and stuff. Also, there does need to be other forms of motivation and excitement coming into your life. And like obviously here at DIYBODY, like we want to personal train you. So you like going to the gym, you like going for your walks, you enjoy your meal prepping and your food selection. But just like a little note is that like once you stop taking those drugs, maybe whatever that was you were feeling before could be coming back. So I also think that big pharma isn't necessarily speaking to that side of things as much as far as side effects goes. And I know that there's more out there. So
Definitely.
Yeah, and we need to look at the GLP-1s and similar as tools, but ultimately the changes made in lifestyle and lifestyle in general is going to be the driver. So I do think that there is a lot of value here, even if we compare a GLP-1 to bariatric surgery, like
Hmm.
how powerful that we do have in alternative, but it's also something that is not one dimensional. And I feel like we've done a really good job in this conversation, adding a little bit more texture to that conversation. Now, when we think of things like cravings and food noise, I feel that that can be very generalized, that it's just our relationship with food and we don't explore it. Where I think of things like cravings and food noise as just our body's way of communicating that there is some dysregulation happening. And this could be layered. So as you introduce a GLP-1, it's a tool to help be able to mute some of that so that ultimately you feel in the driver's seat and then you can be implementing those changes where things feel less amplified. But what needs to be a focus while using that as a tool is continuing to cultivate coping mechanisms, just positive ways of dealing with stress as well as self-regulation. And that's a really important piece. And I feel that that's something that can be neglected in general. How do we keep ourselves in a space that is self-regulated? How do we navigate stress with resilience, where what we're turning to are going to be things that are positive and productive versus just numbing and buffering and avoiding the things that are ultimately hard? Now, in terms of side effects, I feel that we're still very early on. And I think that's something to be cautious of because we do not have the long-term outcomes yet. And when we're having conversations like this, what I feel needs to be primary is risk and reward, right? What are the risks? Is, that reward factor higher up there? And for individuals that are dealing with obesity, this is something that's going to have a drastic impact on health. So there's going to be a lot of potential for positive outcomes with using these tools because for many individuals, losing body fat is something that is going to be improving those health markers exponentially. And again, what a fantastic, safer alternative compared to surgery. But we do need to be mindful, and I feel that there needs to be a really clear narrative, and this comes down to healthcare professionals as well. There needs to be a really clear narrative that making changes to lifestyle is non-optional. It is essential. If you take an average person that has maybe 20 pounds to lose, let's say just the ballpark person, yes, it'll improve health to a certain extent, but much of those goals are also aesthetic. You introduce something like a GLP-1, they make no changes to lifestyle. A year, 2 years from now, their health may be worse.
Hmm.
And I think that's something that we need to be mindful of. And, where is of highest risk is actually the older population that, put someone who's 60 and 70 on a GLP-1 and they make no lifestyle changes and they lose such an amount of muscle mass and then also put themselves in potential risk for, osteoporosis as well, where they've now put themselves in a really vulnerable state. And it's just something that we need to be aware of. Now, I am very open-minded and I feel like these are really great tools. Where I feel there is risk is when they're being utilized for kind of like the last 10 pounds, the vanity 10 pounds, and then individuals are really putting themselves into that place where they are nutrient deficient. They're not getting the fueling they need.
Hmm.
And, it potentially could have been a better approach for them to focus on building muscle so that they're still moving in the right direction and improving their metabolic health. So I do feel it's a layered conversation. I think this is a really fantastic tool for many that have, just continuously struggled to put themselves in the driver's seat to quiet the noise so that they can implement those changes. I think we do need to be aware of just the potential long-term impact when it comes to losing muscle, osteoporosis, and that's going to be from being in that really deep deficit and then not doing anything to provide stimulus and support our bodies retaining muscle. And I think that, everyone within the DIY body community just knows how important muscle is, not only for our aesthetic, but for our long-term health, our wellness, our metabolic health, that we still want that to be a focus as well. Now, in terms of some side effects that may potentially come up, muscle loss is one, nutrient deficiency. So being really mindful of your fueling, aiming for nutrition that is going to be nutrient dense, potential digestive issues, and this will be from that slowing of gastric emptying and just a slowing of gut motility. So things like nausea, vomiting, constipation, and it may just be as doses shift or that transition on and maybe something that regulates. But these are some of the things that can come up. Some lesser common impacts can also be pancreatitis, gallstones, and I feel that there's still some exploration. So in some of the side effects, it's still something that's being explored and I feel less concrete.
And
Mhm.
like I also would say a side effect is like not having that lifestyle change being made and like coming off of that drug, spending all that money and then just like rebounding right away. Like I personally was really interested when I was researching to kind of go like people are saying, oh, they lost 15 to 20% of their weight. And I was like, well, that doesn't say body fat, like that says weight. And
Yeah.
something I preach in check-ins is there is a huge difference between fat loss and weight loss. I could lose 20 pounds if I was suddenly bedridden in the hospital and my muscle withered away because I literally couldn't move. Great, I lost 20 pounds, but I like actually am when I gain that weight back, I will be at a higher body fat percentage than I was previously.
Most people don't even eat enough protein or get enough micronutrients in their diet. So if you already don't have a good eating plan and then you just take a GLP-1 because you see a lot of people losing weight, you're probably just going to be losing weight with muscle rather than having that toned body. And you're not going to get that if you don't go to the gym and you're not eating enough protein.
I completely agree.
And if you're just like taking these and you're not creating like that self-awareness and like improving your mindset around food and whatnot, you're missing out on so much because I'm sure that all of us coaches can attest to like if we've helped someone with their relationship with food, that has come from creating self-awareness around why they're leaning into food, if they're stressed or if
When are we
they
actually
are
hungry?
yeah, yeah, like creating self-awareness is that first step. And then even with like mindset and whatnot, like teaching clients how to track their food, it's not a restrictive thing. It's not from a place of like scarcity. It's from literally ensuring that you're fueling your body properly and like giving your body the micronutrients and the protein that it needs. So if you're not like going through those experiences and you're just relying on these medications, as soon as you come off of it, you haven't really just like grown through the experience and like improved your relationship with food. And I think that that's like the missing piece for a lot of people who don't create like lifestyle habits and like self-awareness around these things.
And I think in some ways, like chasing that instant gratification
Mm.
of seeing the scale go down. But what I worry about is what are things going to look like in 2 to 5 years from that point? And we just want to make sure that we're continuously playing the long game and putting ourselves in a better position, or it can feel like there is potential for follow afterwards if there is not that integrated approach while these tools are being used.
Yeah.
Yeah.
I think it's going to be interesting over the next couple of years, like as these drugs become more popularized and more becomes FDA approved, how expensive they're going to actually get. And, if more and more people are buying these, then, like the supply is going to go way down. And eventually, you're not going to even have access to them. So, I think you're better off to establish these healthy habits in the first place. And, if you do still struggle with losing weight, then, that's where you start looking into it.
Yeah, it can
Um,
be like an addition, a tool,
yeah,
but it's not a quick fix. There's still lots
exactly.
of work to be done.
Also wanted to mention, like, I actually rely on my own body signals to tell me like when is it time to actually eat. So if the GLP-1 is blunting or muting that body response, I think it's going to make things more difficult from a coaching perspective with with clients that decide to use this because like I am looking for those responses when, they're telling me that they're hungry or their digestion is off, but now that that signal is being actively blocked, I'm having to rely on different data in order to make a coaching decision.
Well, I recently worked with a client who was using GLP-1 while during our entire program together, due to some insulin resistance. And obviously, like fat loss was a secondary goal of that. And what we found was when she came to work with me, she was eating maybe 8 to 1200 calories a day maximum. She just physically, violently felt ill after eating. There was no morning hunger cue, there was no afternoon hunger cue. It was mostly just like a oop, like, guess I better eat this, feel sick after, and wait until I don't feel sick anymore to try again. And so what we did was we actually did reduce her dose slightly, and I brought her calories way up slowly over time. And that fat loss started to happen because she truly just was, I don't like to use the term starvation mode, but she really wasn't eating enough to stimulate that thermogenesis or utilizing her fat stores for energy. Like there was just literally like stuck. So I kind of had a little bit of a bone to pick with it there when her doctor was congratulating her for all of this weight loss when really she was probably losing a lot of muscle. She was having extreme food aversions. Her hunger cues and natural body communication was non-existent.
Yeah, and when you're not eating enough food, like that's gonna have a direct effect with your performance in the gym.
Mhm.
You're not fueling your workouts with enough calories because now that your body is just feeling satiated and full, you're not eating as much so that, carbs are the body's primary source of energy. If you're not eating enough fuel, then, your performance in the gym is going to go down, and then you're also going to lose muscle mass because of that.
Yeah. Yeah, we
Yeah.
talk about glucose, glycogen. Like glucose is like muscle is the biggest user of that, and your brain is a muscle too. So for just completely slashing out that entire food group, like it's never going to be a good idea, even if you are on these kind of drugs.
Yeah. All right, so let's finish this off with, if a client is thinking about taking a GLP-1, what should they be doing to offset the risk of muscle loss or any other side effect?
Strength training.
Yeah, strength training, getting enough protein intake, getting adequate sleep, having nutrient-dense meals. So all the things that are foundations for our programs and for our clients, but it becomes increasingly more important that those things are priorities.
Yeah, absolutely.
Definitely. And that will set you up for success for after those fat loss goals because that is one of the biggest issues when people go through fat loss is a lot of people end up gaining it back. If you guys have seen The Biggest Loser on Netflix, there's like that one guy who he's literally lost an insane amount of
Like
fat and
400
he's
pounds.
yeah, and he's like gained it back like 3 or 4 or 5 times throughout his life. And he like even is just like so sad about it when he talks about it. And it just goes to show the importance of like making sure that these habits become a part of your life and that they're sustainable and something that you enjoy and something that you can do long term so that you don't have to stress about constantly like yo-yoing back and forth and struggling with that.
Mhm. Yeah, and I think even like just having like a couple of positive mantras around food when you are hungry, like personally for me, I'm saying food's gonna be there tomorrow. Like if this snack that I can't stop thinking about, I really want it. Okay, if I have it, great. But if I know that in my goal of a fat loss phase, I know I can have it tomorrow, and 9 times out of 10, I can track it, I can make it fit, I can make it work. Obviously, I'm not trying to downgrade anybody who does maybe struggle with that relationship with food, but for maybe the ballpark client wants to lose 20 pounds, like a little bit of patience and trust in yourself can really help build that reward pathway in a new light.
Yeah, any other aspect of a GLP-1 that you guys want to talk about before we wrap things up?
No, but I think this discussion should be something we continue to talk with our community, and rather than like fearmonger it or immediately smack it down. Like if anybody ever has any questions about GLP-1s or wants to learn more, don't ever be shy to ask us.
All right, so we hope you guys got some useful information from today's round table. If you guys are considering taking a GLP-1, talk to your doctor first. And yeah, other than that, hope you guys enjoyed it, and we'll see you on the next one.